All right, let's move to this very concerning issue now. We have seen the stories on the problems at many of our government hospitals. Krisani Baragwanath Hospital, the largest in the country, running out of bread recently. Charlotte Maxeke in Johannesburg, gutted by fire and then vandalized, still not fully functional over a year after that blaze. Maternity patients filmed on the floor at Rahima Moosa Mother and Child Hospital. But an open letter written by a well-respected paediatrician this week has shown us that perhaps it's even worse than we thought. Dr. Tim de Meyer writes, and I quote here, "Children are dying and the horrendous conditions at our public hospitals are contributing to their deaths." He goes on to detail doctors trying to intubate young patients by the light of their cell phones when the power goes down, other issues, a neonate going cold when power cuts have turned off the warmth, having to explain that a child will wait months for a brain scan as the machine is broken. He says hospital-acquired infections are running rife. He says doctors are driving from hospital to hospital to try and find supplies. It's absolutely appalling. Dr. Tim de Meyer's letter has sent shockwaves through the community, but also the medical fraternity, and this is crucial, is backing him up. I'm joined now by Professor Haroon Saluji. He's head of community pediatrics at Wits University. Prof, what was your first reaction when you read Dr. Tim de Meyer's letter?
Sally, I know Dr. de Meyer from very well. He was an intern working in rural Limpopo when I first met him, and I know him as a true pediatrician. He's a very gentle soul, he's quiet, he's a friendly soul, and so for Tim to be able to write this letter came as a bit of a surprise to me. But he has expressed over the last year his increasing frustrations to me. He's pulled out of the academic teaching program at Wits because he said he was just too busy to come through. And so it didn't completely surprise me, but the level of his frustration and the tone of his letter clearly is of great concern.
He writes, "Children are dying and the horrendous conditions at our public hospitals are contributing to their deaths." Do you agree with him?
Yes, I do agree with him, because I think what Tim describes is the complete storm. So there are a number of factors that, and he outlines them, that contributes to reduction in quality care. So among them, it's the issue of inadequate staff, just not enough doctors, but particularly nurses for the patient load. And certainly the situation at Rahima Moosa has been far worsened by the fact that Charlotte Maxeke has been closed for so long and they've had to take the load. So a very busy hospital with greatly increased number of deliveries as the load has become more. Added to that, they've had problems with getting adequate equipment. He makes that point. And then we've had the crises with both water availability and, to top that all, the regular load shedding, which means their generators weren't coping. So you add all of those, and so you end up with a major storm. And it shouldn't then be surprising that children's lives get affected, because for one of the major killers, particularly of newborn infants, is sepsis. And in an environment where things are overcrowded, where there aren't enough staff, and then you don't have adequate water and sanitation, it's an absolute disaster. So his sentiments are completely understandable. And it's not just anecdote, it's based on fact. Children will die in the kind of situation that is currently existing at Rahima Moosa.
And one of the things with the release of the health budget recently, speaking to the health ministry, they flagged that they are getting sued for malpractice so often. It's no surprise when we hear about the conditions in our hospitals. We also know that the health budget has been cut, that nurses who were hired during the COVID-19 pandemic are being let go because there just isn't the money for them. How do you understand why and how this is allowed to happen?
So we're in a vicious cycle where the health budget in many provinces, a quarter of the third of the budget, the health budget, is now being spent on negligence claims. And so all that money goes away from providing the kind of basic services that are required. So that's the first step. And then overall, because of the crisis in fiscus, the health budget is either being decreased or not accelerating. And therefore, you end up with even less money. Now, you need to address these basic health issues. You have less money than you had last year before. You provide worse services, and the litigation continues. So we're in a very, very difficult situation, a really vicious cycle. And one has to find a mechanism to break that. To me, what needs to happen is quite clear. I mean, Rahima Moosa is an example, and it's a hospital in crisis. There's no doubt to me that in the first instance, that hospital needs urgent attention because, as I said, it's been the perfect storm with so many factors affected. But the truth is, Rahima Moosa is not exceptional. There are hospitals throughout Gauteng, and I would argue throughout the country, that are in very similar situation. Your question is an incredibly difficult one, Sally. So how do you break this cycle? And the answer is, I think, clear, that at a hospital level, at a hospital by hospital level, the managers, the people who are responsible have to take more responsibility. And part of the problem is things like water and electricity is not within the ambit of a hospital CEO to fix. But that doesn't mean that absconds responsibility from them, because it means engaging with the district. And that's the issue.
Now, you make a good point, because that, of course, is an infrastructure issue and relates to Eskom and water suppliers. But issues such as running out of bread at the biggest hospital in the country, surely that speaks to either you don't have the money or you've run out of money, but it speaks to someone who doesn't know how to run a budget, or does it speak to someone who simply doesn't have enough money?
So I think it's both those issues, but a lot of it is suppliers haven't been paid, and clearly when a bread supply doesn't get paid, his only option then when his overrun is over a few million rands, he's going to stop providing bread, and there aren't alternate mechanisms. So you're right, there's a lot of bureaucracy, but a lot of it is simple management of the day-to-day running of a hospital, including how it pays his accounts. And the truth is that many hospitals are faltering at that. And that, I agree with you, is completely unacceptable, because it's not just about not having money, it's about how the available money is not being adequately monitored and spent, that these budget overruns are allowed to happen so that the suppliers in frustration stop something like bread supply.
I think reading Tim de Meer's open letter, he asks in that letter, he asked government officials if they'd send their own children to a government hospital, knowing that equipment is failing or vandalized or broken, that staff are overworked, absolutely burnt out. And he asked them how they sleep at night. And I'm wondering, first of all, has there been any real response? It seems from this point of view, and certainly from what the doctor has written, that no matter how awful the stories get, there isn't really an adequate response. Do you think it's a lack of care, lack of interest?
Well, certainly the immediate response, I think Dr. de Meyer has had responses from various people, starting from the presidency, from people within Gauteng Health. So it has had the immediate response of saying, what is the crisis? What can we do about it? But the problem with this is that it's not a problem that has occurred over the last week or the last month. In his letter, he notes that there's been 3 letters dating back all the way to 2018, I think he mentioned. So this has been a long-term crisis. And my concern is that we will hear about this. All of us will be deeply offended. But within a week or so, the pressure will go down from the public, that the health authorities will ride out this wave of indignation and upset on the part of the public, and things get back to normal. So people like myself who've been in the system for 30 years are very skeptical about we will get the longer term gains. However, as child health advocates, we are very keen that this crisis should not just result in lots of fury and anger and then die. And so we will certainly be doing 2 things. One, asking Rahima Moosa to clearly articulate what the needs are, what has to happen, and obviously push for that need, but then to extend it to beyond to the other hospitals as well. As I said, this is not new. We have put many of these requests, whether it's about staff, whether it's about basic equipment or basic infrastructure. One of the biggest problems at the moment, just to let you know, Sally, is in fact newborns. Those are the ones who are the babies who are struggling the most, because as healthcare has improved, we've got more and more preterm and premature babies now requiring care, and we just don't have enough space for them and not enough staff. So we will be, as child health advocates, not only taking the issue of Rahima Moosa, but looking at the issue within the country. But as I said, it's a long struggle because it's not a new problem.
But it's a critical issue, and we cannot fail our children in this way. And we will, on this programme, do our best to keep this issue in the spotlight. And thank you so much for being so frank with us this evening about the troubles facing doctors in public healthcare. Professor Haroon Saluji, he's head of community paediatrics at Wits University.